All right, good afternoon, everybody. In addition to Josh and Paul, we have Reg Eady and Deirdre Gifford, who you maybe remember were our co-chairman of our Vaccination Advisory Board. And we're going to spend a little bit of time, a lot of time, I hope, talking about the vaccination rollout plan. But first, let me set the table with our COVID daily summary. This is the good, the bad, and the ugly. What you see is a lot of tests. I guess that's good. A lot of these tests were part of the run-up to Thanksgiving, in and around Thanksgiving, where you saw the crowds. A lot of cases, and the 7.13 positivity rate over 7%, that's the highest we've had so far. Let's cut to the chase. You know, back in the spring, you were testing a different cohort. This is broad-based testing, 7%. And I think a lot of that was not unexpected. It reflects the fact that, again, all the travel back and forth, maybe stirring it up, maybe the beginning of some of the Thanksgiving effects that we had anticipated, but it's a big number. Good news is hospitalizations are down. They have not been down for, I think, over a month. And it's a one-day number. Don't be a day trader, but it's worth looking at. Fatalities, another 20 fatalities. The governor's vaccine advisory group, you can see Reg up there in the corner, Deirdre, an incredibly diverse group of people who are healthcare professionals as well as representatives of the greater community, the religious communities, underserved communities, disabled communities, those that when the vaccine is ready to go, and it's almost ready to go, we can get out into the communities, explain to people why it's very important to them and their community and their families that they take the vaccine. We'll talk about that. So here's the timing on the vaccine's upcoming milestones. Timeline subject to change is an important asterisk there. We just got notice that Pfizer may suffer some delays in terms of supply chain right now. But let me tell you what we had anticipated and what we've been getting told. Today is December 3rd. In 1 week, we're going to have the FDA review of the Pfizer vaccine. It'll probably, they anticipate, take 48, 72 hours to complete that review. We anticipate the approvals. They're counting on those first shipments of the Pfizer vaccine around the country, including Connecticut, a week from Monday, December 14th. We anticipated about 31,000 doses. We'll see if that changes, given what we have been led to believe. Secondly, you've got also the Moderna vaccine. That's on a separate approval process. That's scheduled, a week from Thursday or 2 weeks from today for the FDA review, and they'll have their vaccines scheduled for delivery, as you can see here on the chart, on the 21st of December. Merry Christmas. That's a bigger shipment, 63,000, assuming we can stay on track here. And this is really important in terms of rolling out this vaccine right now. We'll be able to talk about that in just a minute. Who's the first to receive the vaccine? We followed the CDC guidance, and they've rolled out a list of priorities that they recommend. I think you'll find from our vaccine group that we sort of followed their advice. We thought it was very sensible. Number one, Phase 1A, 204,000 workers, healthcare workers, doctors, nurses, docs at the hospitals as well as the clinics, the federally qualified health centers, front-facing people doing everything we can to keep us safe. That's priority number one. And to make sure that they're able to get that vaccine so they'll be able to keep at work. Secondly, and right alongside are nursing home residents and nurses, 22,000 nursing home residents. I think you can understand what the thinking is there. Number one, these are the folks most likely to suffer complications. These are the older folks who most likely suffer fatalities. And these are the folks most likely to go into the hospital. So not only are we hopefully saving lives, we're hopefully keeping these folks out of the hospital, which again adds to our capacity in the hospitals, why that's also in our first tier of vaccine receivers. And thirdly are the medical first responders. Those are EMT, Those are fire and police to the degree to which they're driving ambulances, everything we can do to make sure they stay in the battle as well. Josh reminds me, these numbers are exact, but they assume only an 80% take-up at this point. So there'll be some variability. We're not mandating this, but I think you're going to see significant take-up with our strong recommendation. The vaccine distribution chart, which is here, little complicated, I guess, and it may be changing, as we're hearing right now. But as of 12/14, we're looking to do the first 31,000 doses. And you can see they ramp up in the next week, 12/21. You've got 94,000 doses. That's because you're adding on Pfizer as well as Moderna. And you can see at the end of 125, we'll have distributed about 380,000 doses. That's over the next 6 weeks. Of those 380,000 doses, which are going to those first responders, that second column, it says second dose down there, if you got good eyesight, 212,000 will have received their second dose. So that means that by January 25th, we think the overwhelming majority of those first responders, nurses, docs, nursing homes, will have had their first and second dose, and another 150,000 will have had their first dose in terms of the next tier of people we're talking about. It is complicated. Pfizer, you got to refrigerate it at a much lower temperature. Pfizer, it's every 3 weeks. Moderna, you refrigerate it at a different temperature. That's every 4 weeks. And that's why we have our extraordinary vaccine committee to make sure we're rolling this out in a way that gets it implemented properly. When we get the vaccines, we've got to make sure that they can be delivered on a timely basis. So, Phase 1B. Phase 1 were those absolutely necessary healthcare first responders and the nursing homes I described. Phase 1B, which they start getting their first dose by the end of January, and it's really mid-January to late May. Critical workforce. These are folks on the front line. These are everything from daycare, food service workers, folks taking care of the most disadvantaged in the community, including some of the state employees. That includes teachers. That includes folks who are interfacing every day with the population on a critical basis. They can't telecommute. They can't go virtual. Also in that group are what they call other congregate settings. That can be group homes. That can be correctional facilities. Why is that? Because like nursing homes, they have much more likely a possibility of spread. No matter how serious our precautions, we're finding community spread often gets into these congregate settings. Thirdly, in Phase 1B are adults over 65. Hey, that includes your governor for reasons you can imagine in terms of age and how the infections hit. And fourthly, and probably the biggest category, is high-risk people under the age of 65. And Reg and Deirdre can tell us how those are quantified. Phase 2, which will not start till later, late spring, early June, or June, depending on what the flow of the vaccines are. Those are younger people, under 18, obviously the youngest, least likely to shed the virus, and those remaining over 18. So I think you can see the prioritization, why we're doing what we're doing, and when you can expect your cohort to have access to the vaccine. It's not all good news, so I have a little fun here. I can't sleep. I'm too excited about the vaccine coming, they say as we lead up to Christmas. Just to give you a thought. CDC's been busy, and they also came up with new quarantine guidelines, which I think are worth paying attention to. They said, look, if you're not showing any symptoms and you get a negative PCR test, you only have to quarantine for 7 days. Or if there are no symptoms at all, quarantine for 10 days if you haven't taken the PCR test. 14 days is still recommended for high-risk situations. No offense, but just don't go visit your grandparents for 14 days. Probably nursing homes, stay quarantined, not that many places to go. So that gives you an idea of the continuum there. Thanks. I was on the 14th day of my quarantine when the CDC said 7 days with a PCR test is maybe enough, but I'll get over it. Look, more importantly, I'm so thankful to you, Reg, and you, Deirdre, as if you needed more things on your plate, the incredible work you have done in this changing circumstances, not just in terms of our infection rate, but what we're hearing from the pharma companies, what we're hearing from CDC. Our work is just beginning, and it starts right now. We have a chance to answer questions because there are going to be a lot of questions from people about the vaccine. Josh and Paul as well to answer.
Channel 3 Eyewitness News.
How will the vaccine get to the state? You know, what airport will it be arriving at? Then what are we talking about as far as ground transportation? And then once they get to the hospitals, how will it get to the general population, or at least the healthcare workers for now?
All right, vaccine board, you want to take that?
So the U.S. federal government is managing the logistics for delivering vaccine to the state of Connecticut, both for the general supply that's coming to hospitals and other vaccinators, and for the supply that's going to go to our nursing homes through CVS and Walgreens. So all of that logistics, they are taken care of through Operation Warp Speed in partnership with CDC. And then from there, so to answer the second part of your question, the state will designate at the governor's direction where we want the allocations to be shipped. So the governor showed the number of doses that we are anticipating and planning for, although they're subject to change. On a weekly basis, we will direct our federal partners where we want those to be shipped. And that will obviously evolve as the populations and the numbers evolve. And then from there, the vaccinators will either have the vaccine that they need shipped directly to them, or in some cases, there will be maybe a hub and spoke model where we'll transport some quantities of vaccine to vaccinators on a just-in-time kind of a basis.
Thank you.
News 8.
So according to this timeline, and it's subject to change, June is kind of the end date when the last group of young 18 and under get it. Where does that leave us in the future? Does that mean this summer the masks come off? Do we still have to take precautions? People are really anxious to know when is this coming to an end, and not that there's even an answer to that, because you have to look at a crystal ball, but can you give us an idea of what happens when everybody's vaccinated?
Deirdre, what happens?
So don't get rid of your masks yet for a couple of reasons. One is we don't anticipate full vaccination even according to this schedule, right? We're going to need to wait and see. We certainly hope that there'll be widespread adoption of the vaccine, but we're going to need to wait and see what percentage of the population takes the vaccine. We'll continue to learn about efficacy. And, we have an annual flu vaccine, and yet people still get flu on an annual basis. So the answer to your question, as you indicated, will evolve as we see the program rolling out. And we'll have more information about the potential to back off on some of our mitigation strategies over the summer. But I think we all need to just prepare ourselves for the continued need to protect ourselves, and particularly high-risk individuals, from COVID or through the majority of 2021.
And also, how is it being received by the medical community, the frontline workers? You have to order doses now for them. Have you any idea, taking surveys, 50%, 60% will take it or not? Do you have any numbers, even just for one hospital?
Want to take that?
Yeah, sure. I'll be happy to take that. So, yes, we did survey, and I'm sure the other healthcare systems did as well, at Trinity Health in New England. Interestingly, our response rate was very high. It was north of 40%. And we surveyed all 13,000 employees. Most of them are nurses. Most of them were 55 and above. Over 60% said they would take the vaccine as soon as it's available. And that's without education, further explanation. We learn things every single day. So the goal here is to understand that all of our healthcare systems and all the those participating in phase 1A, sort of where they stand. And it gives us just a little time to answer questions like we're doing today. Most of the questions that, at least at Trinity Health in New England, were around efficacy, safety, and will we have to get the vaccine if we've had COVID. So all those answers, as we learn more about it, will be provided. And again, the hope is that more will participate so that we can get to some degree of normalcy as soon as possible. Thank you.
NBC Connecticut.
How much are you expecting it to cost us to distribute the vaccine? Does the state even have enough money to do so?
Right now, the feds, as you know, are buying up the vaccine itself and handling the distribution to our locations. Deirdre, do you want to talk anything else about what there might be at the local level?
Yeah, I'll start, and then I know Reggie has additional information to add. First of all, I want to make sure everybody knows that vaccines will be available to everyone, even those without health insurance, for no cost. So everyone should be reassured that they will have access to the vaccine when it becomes available and when their group is, when their time is up on the schedule for their particular population group. The other thing is that vaccinators who are healthcare providers will be able to bill insurance for the vaccine administration costs. So right now, if you go to the doctor and get a shot, the doctor is able to bill both for the vaccine itself and for the cost of administration. That reimbursement will also be available for this vaccine. So, Reggie, you might have additional information about how the health systems are thinking about the cost.
Yeah, and outside of any additional cost, just having the ability to store adequately and in compliance all the vaccines were the other charge that we had. And so if I remember correctly, there are at least 12 hospitals that are prepared to store the Pfizer vaccine, which is really, I think, the greatest challenge we have at this point, as the governor alluded to. But outside of that, there are no additional costs. I mean, training is being provided. The state is providing us training from that perspective. We are doing what we need to do inside of each hospital to ensure that we can continue to do what we've been doing a good job at thus far since the pandemic started, and that is providing high quality and safe care.
I guess what I was getting at was the concern I've heard from other governors, including Governor Cuomo, that distribution could be hindered because of a lack of federal funding that you're still waiting for the feds to act on.
We're still waiting for the feds to act. We've been waiting for the feds to act for many, many months. There are some related costs. You're absolutely right when it comes to getting information out about the vaccine and the outreach that's going to be necessary there in terms of the administration of the vaccine, some of the IT work that's got to be done, not to mention testing going forward. Fortunately, Connecticut's in a relatively good position compared to some of our peers. We underspent in our current budget year, so we do have some resources we can reallocate to testing and the vaccine for the very near term, and we do have a rainy day fund if we're in a pinch. So we're not going to do anything to shortchange getting this out effectively.
Okay, and lastly, there's concern among the immigrant community that information collected during the vaccination process could be shared with ICE, discouraging those who are undocumented to even get vaccinated. Since the vaccine is going to be distributed at the local level, will the state have any latitude to create a protocol that keeps that population from being excluded from the process?
We did that with testing, we did that with hospitalization, we'll do that with vaccinations. This is confidential to the degree to which ICE and nobody else is going to be notified of any of this. I don't want to do anything to discourage anybody, documented, undocumented, to come in and make sure you know you can get this vaccination, get it safely, and get it confidentially.
Thank you.
Fox 61.
Hello, everyone. An additional question and comes to minority communities. Have we taken a survey in these populations where we see these increased numbers to see if they also are okay or are comfortable with getting this vaccine?
Reg, you want to handle that?
Absolutely. So I've had a number of conversations. In fact, on yesterday, I had the opportunity to meet with 8 local pastors of whose congregations are considerably large. And we had that open and honest conversation. The day before that, I met with about 15, 18-year-olders, or actually high schoolers and freshmen in college, as well as a group of leaders, minority leaders in the state as well. One of the conversations, we did do a survey. We did pre-presentation survey, and I think it was around 38% said that they would take the vaccine once available. After the conversation was over, an hour and 15 minutes later, it went up to about 60%. Outside of that, there's not been a survey, but I can tell you that a number of the pastors have invited me to speak to their congregants so that they can be exposed to the conversation that we had. And the responses were very positive. Once they understood this new RNA technology, once they understood how we're able to produce, or the manufacturers are able to produce the vaccine in such a abbreviated or short time, and how it doesn't necessarily at all suggest that it's not safe. And that's because they're doing it in parallel versus in series. People felt a lot more confident, and they're willing to continue the conversation. And I believe in the hearts of hearts, they are becoming ambassadors, suggesting that we as a state should all consider the vaccine.
And I'll just add to what Dr. Edie has stated as well. I think that was one of the main reasons of the comprehensive nature of the creation of the vaccine work group, spearheaded by the governor, co-chaired by Dr. Edie and Dr. Gifford. We have a communications committee within that is made up of individuals all over the state of Connecticut in very diverse backgrounds. And based upon even Dr. Edie's example, what you see is that when individuals who are respected individuals in the community are the ones who are speaking about the importance of a vaccine, it leads to more comfort and more individuals who say, yes, I will move forward with that. It's not only about information that you provide, it's about who's providing the information. And that was a main aspect of our overall work group.
Thank you both. And one more question. Do we have a plan for our homeless populations and getting into them?
Yeah, so my understanding is that all healthcare systems within Connecticut have such a community health and well-being outreach program. And so, yeah, that is being considered. So, at some point within the phases, we have to reach out to the community, the vulnerable populations, ensure that we pull them all in. And so, yeah, they are a part of the plan.
Thank you both.
WTIC 1080 News.
I'm here. Dr. Edie, what have you been told about the Pfizer delay so far?
Just exactly what the governor just suggested. I mean, we were actually logging on when we were informed that there's some issues with the supply chain, so that may pose a delay. What we don't know is, will it be in the first tranche? Is that impacted at all or not? So I probably know just as much as you know or less, because we found out literally right before we started this press conference.
I think we need to look at the delay may already be baked in the numbers that the governor showed. Based on the news reports, it may be that there was initially a larger promise that's now been scaled back, but the numbers we have may already reflect that. So we'll need to follow up and see if there's any change in what we're expecting.
Yeah, fingers crossed on that.
And Mr. Governor, if you could, a comment on Rosa DeLauro's appointment to House Appropriations.
Well, I'll talk about that in a minute, but it is a very big deal. Let me end on that, if you don't mind.
Thank you.
News 12 Connecticut.
Good afternoon. You mentioned that people in the prison systems fall under Phase 1B. The ACLU is calling that they're one of the first to be vaccinated, and then it seems like the timeline, it could be from January all the way until June Where do they fall on that timeline and your response to the ACLU?
Deirdre?
Yeah.
Or Reg?
So one thing I think it's important to stress is that some of these subcategories that we've talked about, we have further work to do in partnership with our federal and state and local partners in further delineating the priorities within those groups. So obviously some of the categories that we've mentioned this afternoon are very broad, and there's much more to come in terms of further stratification. And in fact, the CDC, it's just coming across my phone now, the CDC has issued some further guidance just this afternoon, and that will continue. I will say that we recognize that correctional institutions have been nationally high-risk areas. Our Department of Corrections has done a really excellent job in keeping our both offenders and staff safe, and we're all continuing to work very hard with testing and quarantine and isolation. But we understand that, the nature of the risks there, and we'll continue to work on further prioritization within those categories.
The Associated Press.
Thanks, Max. Good afternoon, everyone. I'm assuming that Connecticut, in its initial distribution, will not get enough vaccine to cover every healthcare worker who comes in contact with COVID patients. So who among healthcare workers would be prioritized?
So I'll take that, Commissioner. So a couple of things. One, based on the surveys that we've done, 100% of the workers don't want the vaccine at first. So you're absolutely right. At first, we will not have enough to vaccinate all those that are classified as healthcare workers. So within the prioritization we received from our federal partners, or namely the ACIP, we, because there's not going to be enough supply to match the demand, have to do, as the commissioner was just alluding to, additional prioritizing. And so so what we're talking about now, and again, things are subject to change and not definitive, but will be by the time the vaccine reaches Connecticut. We're looking, let's say, within the hospital, for example. Within the hospital, there are certain departments like the emergency department, intensive care units. Those are the ones that will probably go first because they're caring for COVID patients. So where COVID care is being provided those are the areas we want to target initially. After that, then we will, of course, expand it within the hospital, but of course, outside of the hospital. We've got urgent cares, we've got federally qualified healthcare centers, we've got primary care offices that also need to be included in the initial tranche. So again, those conversations are still happening amongst our allocation subcommittee, and we will have definitive answers in the near future.
Is there any thought of perhaps distributing it based on population density in a county or where there's a higher number of COVID cases?
Let me just add to Dr. Edie's comments that if you looked at the schedule that the governor shared, we actually, right now, the dosage allocation that we have been given would allow us to do a first dose of almost the entire healthcare and nursing home population by the end of January. So we're talking a matter of weeks, not months, within the healthcare workforce of rolling this out. So what Dr. Edie said, the work that's ongoing in terms of who is the very first to get the vaccine is obviously important. But other healthcare workers in that 1A population won't have to wait very long before they too will have access to the vaccine because of the number of doses, at least as of today, that we're anticipating getting.
Oh, okay. And also at the nursing homes, will there be any prioritization of residents, like by a certain age or anything like that, or it's just pretty much everyone that's in a nursing home a resident? And I want to make sure, too, that number included nursing home workers.
The number that the governor showed for nursing homes was residents only, but the number he showed for healthcare workers includes the workers in our long-term care facility.
Okay.
So they are both in phase 1A, And with respect to your question about prioritization within the long-term care facilities, we are anticipating that the Walgreens and CVS arrangement will very quickly be able to administer doses to the whole system, residents and staff. So such that we really don't need to stratify within, because they'll be able to administer, as long as we allocate the doses to them, they'll be able to administer the vaccines relatively quickly.
And are you just talking about nursing homes, or are you also lumping assisted living in those figures?
Assisted living is in the long-term care definition, and those will follow the nursing homes.
I'm sorry, I missed that. They will follow, or they're okay. And Governor, just a quick one. There were more than 100 restaurateurs that were on a call today with Senator Blumenthal, asking him to ask you to release more of the funds to help restaurants. They say that the $5,000 grants won't be enough. I wondered if you could please respond.
Yeah, I'll ask Senator Blumenthal to ask Mitch McConnell to do another PPP, Paycheck Protection Program. It's absolutely vital for our small businesses that they get the support they need. You're right. We sent out 10,000 checks in the last week or so, $5,000 apiece to the smallest businesses. We are one of the greatest recipients per capita in terms of the PPP in the last round, and that has run out. We can. We really need the federal government to help us take the lead. We can provide a bridge, we can provide some support, but this is a federal responsibility. They've been derelict there.
Okay, thank you very much.
The Norwich Bulletin.
Afternoon. This is Macron, the Bulletin. This in terms of distribution of the vaccine. I've covered a lot of that, but I guess who's tracking how many doses have been given and to whom, and also how will security for the vaccines be handled?
Back to you, Deirdre.
So we will be tracking, along with our federal partners, the doses. The hospitals and local health departments and other vaccinators who are working with us have signed an agreement with us that specifies they will enter in the doses into our electronic system. There's a federal system that will also track and gather the information nationally about vaccine administration. And then with respect to security, the partners that are receiving vaccine, they sign memorandum of understanding about safe handling, et cetera, of the vaccine product.
Yeah, and just to offer a comment of security. Remember, many of the vaccinators already have secured for many years their ability to store and keep safe pharmaceuticals. So this will be sort of business as usual for the hospital systems and other vaccinators.
Okay, and one other thing, if you don't mind me asking, I guess as the process goes on, what are some of the hurdles you've encountered, and I guess what are worries you have as things continue?
Well, I'll start on that. This is a monumental management issue. I mean, 3 weeks, 4 weeks, coming in different supplies, prioritizing populations, refrigerated 90 degrees below zero, refrigerated 32 degrees, making this get out there and implement in a way that works. If I have, some caveats, it's convincing people that we've got the vaccine. We worked it very hard to get it to you. Now's the time to take it to keep yourself safe. This supply chain hiccup regarding Pfizer makes you think that there are a lot of moving pieces before the vaccine even gets to Connecticut. But right now, I'm very hopeful, and this is a good time. We need some hopeful.
Hearst, Connecticut Media.
Thanks, Max. So what is the time frame for the incarcerated and corrections staff, and how will it be broken down between the different people working inside some of the corrections facilities and So for example, guards or somebody working in a prison hospital or something of that nature.
Who wants that?
Well, we'll work with the Department of Corrections. We've been working with them really closely on testing and all the management issues throughout the pandemic. So we'll continue to work really closely with them on rolling out the vaccine. As I mentioned, the team there has done really an excellent and commendable job throughout the pandemic. And I'm sure they're already beginning planning for the questions that you're asking, and DPH will be working alongside of them for the rollout.
Thanks. And then, Governor, I wanted to get your reaction. Today, the incoming Republican leadership asked for you to delay the upcoming property tax requirements for state businesses that are trying to stay afloat in the pandemic. Is that something you would consider doing?
Look, we can take a look, but let's start by talking to the mayors and first selectmen who are also trying to stay afloat, and they need to make sure that they have property tax coming in to maintain cash flow to keep teachers and firemen and cops employed. So one step at a time.
Yeah, and I'll add as well, Governor. I know I've reached out to, on the governor's behalf, to CCM, and we'll be talking the cost. Hope that Republican leaders, in making such an announcement, reached out to their mayors and first selectmen. But it's also great that they finally realized the importance of the governor having the emergency powers. They were asking for this provision to go beyond April, to go to April. Our emergency powers actually ends in February. So we'll do a little homework for them on that. But overall, I think one of the things that we've always shown with our emergency powers is that we talk to the very constituents that are affected. And so we're going to first talk firsthand with the municipalities, first selectmen and mayors, and the financial directors of those towns and see what the overall effect of that is on them. And then we'll make a final decision.
Thanks. And then one more question for the co-chairs, if I may. What will people get a choice of which of the vaccines, which of the actual jabs they get, or is that going to be subject to availability?
Well, I can say that if we have both or all three vaccines, regardless of the number, as long as they've not received their first injection, we would have no problem as a vaccinator them deciding which one. As long as people are getting vaccinated, that's all we really want. And to the extent where, they want to choose which one they prefer to get vaccinated, then, we will support that 100%. We just have to remind them that whatever one you get, at least for the first two that we'll have, you can't mix the injection. So if you start off with Pfizer, you've got to stay with Pfizer, and the same thing relates to the Moderna vaccine.
Thank you.
The Hartford Current.
Hey everyone, this is Emily Brindley from The Current. To start with, I'd like to ask Dr. Eady and Dr. Gifford, has the Vaccine Advisory Group submitted a formal recommendation to the governor's office? Because it's my understanding that that hasn't happened yet.
So, yes, the timeframes here are by necessity very compressed. So the ACIP met on Tuesday. We actually delayed the meeting of the subcommittee until that meeting happened. And then they formulated their recommendation by consensus, which was transmitted to the chairs and shared with the rest of the main advisory committee and then transmitted to the governor today.
And you're talking about the allocation subcommittee that met this afternoon, is that correct?
Yes. No, they met yesterday.
They met yesterday? Okay. And so was the entire advisory group able to weigh in on that allocation plan before it was transferred to the governor's office?
We shared the recommendations from the allocation subcommittee with the larger advisory group and asked for input. And I'm not aware that we received any additional commentary from that group. I may have some emails in my inbox, but they did receive the sum of the recommendation and an invitation to share their feedback with Dr. Eady and myself.
Okay, and could either or both of you explain to me a bit about how the advisory group will be working going forward? Because my understanding was that the group was going to kind of come together and make these recommendations before it comes to the governor's office, and it sounds like that process got a little bit jumbled here just because of the necessary timeline. But how will that group be functioning going forward, and what other sets of formal recommendations do you plan to send to the governor's office?
Yeah, so the three subcommittees. So we've got communication, we've got science, and we have the allocation. The three subcommittees, as information comes in, and that happens seemingly for this week, the last few days, every day, they will be deliberating and making recommendations to their co-chairs, and those co-chairs sit on the advisory group. We collectively, the advisory group that is, we collectively sort of synthesize that information, and then we make the recommendation to the governor. Our intent is to not change that model in terms of communication and recommendations to the governor. But of course, things are happening very quickly, and we're literally moving meetings around based upon when our federal partners that we learn are going to be making decisions and recommendations to us.
Yeah, if there's any other information, of course, you can find it on the DPH website that has the vaccine task force on there. But as the co-chairs have stated, yes, things are moving quickly. The governor received a very thorough overview from the co-chairs to be able to accept the recommendation that came from the allocation committee that went up to the bigger board. But one thing that for sure, as we've always done going forward, this is public health we're talking about. So we're going to be open and transparent with it. I know next week myself and Deidre Gifford are going to be on a roadshow with legislative leaders and all the various caucuses, and we provide information to them as well. There's a lot of information that we're providing, and it's going to be out there, and it's going to be available. Any questions, we'll answer it.
And one last quick question for you, Governor. So on Tuesday, you were on the radio and you said that you would consider shutting down some restaurants or pulling back on some restaurant openings in between Christmas or New Year's and somewhere along that timeline. Is that something that you're considering doing? That seems to be a stronger stance than you've taken so far.
I don't know about that, but every week we look at the numbers, and we are going to react accordingly to do everything we can to keep people safe. Every week I'm talking to my fellow governors as their metrics change as well. Obviously, when it comes to things that are open and closed, doing things on a regional basis, Emily, are just so much more effective than doing them by ourselves. But at this point, no plans to change. I think right now we're doing pretty well.
Thank you.
The Connecticut Mirror.
Hi, everyone. A clarification on Phase 1A. Is it the intention for the first few batches of vaccines that come in, go through all the healthcare workers first, then do nursing home residents, and then first responders? Or will those three groups be done simultaneously?
We are working to get the doses to our nursing homes at the earliest possible time. And we've been in conversation today and multiple times and yesterday after the allocation subcommittee met, looked at the ACIP recommendation of moving nursing home residents into Phase 1A. We started working on a strategy to get those doses for the reasons the governor articulated, to get those doses out to our nursing homes at the earliest possible time. So, the CVS and Walgreens are just standing up this program. We're trying to work through all of the details, but the plan is to get those doses into the nursing facilities at the earliest possible date.
So they would be first priority. Am I hearing you correctly?
That they would be at the same time as the other healthcare workers. But again, I want to emphasize the fact that we really anticipate having ample dosage to do the entire 1A population by the end of January. So there's not going to be a long delay from the first week of the program to the last week of Phase 1A. But because of the nature of the infection in our nursing facilities and their vulnerability to this infection, we really, and the allocation subcommittee agreed, want to get the doses into those facilities as soon as we can.
Within the time frame you just described through late January, is it up to the nursing homes and the hospitals whom they vaccinate first, whether it's by age or, maybe people who've recovered from COVID versus not recovered?
Do you want to speak to that one, or I can take it?
Absolutely. So we're going to follow the recommendations that came from our federal partners, the ACIP, to the extent that they don't change. We're going to comply with them 100%. And then we're going to also take the recommendations from our 3 subcommittees, and the advisory group would then decide on what recommendation to make to the governor. So we're bringing all of that together. But the intent is to, as we said many times, to get everyone vaccinated as quickly as possible. And I think the rate limiting factor really is, one, how much vaccine do we have available? And then 2, how many people are willing to receive the vaccine?
Is there a requirement for hospital workers or other healthcare workers to get the vaccine? And for those that either can't receive it or elect not to receive it, will work procedures be different for them than from the workers who are vaccinated?
Yeah, I know of no mandates, if that's where you're going, for healthcare workers within the hospital. But to the extent where there's a significant number, which based on what the commentary I gave earlier, we don't think that that's going to be the case. But in the event that there are some workers in critical areas like the ICUs or the emergency department who don't want to get the vaccine, then we've got to consider that and their safety as well as protecting the members of the community that we serve. And we'll figure that out. But I'm confident that as long as we continue to provide elucidation around the efficacy, the quality, and the safety of the vaccines, that the men and women in the state of Connecticut that save lives every single day will raise their hands and say, it's the right thing to do. We'll get the vaccine.
And lastly, for the phase 1B, are you guys looking at correction staff, incarcerated population, or both? And how do you prioritize?
Both are currently, except the medical staff in correctional facilities, which would be healthcare workers in phase 1A, both are currently in phase 1B.
Thank you.
Connecticut Public Media. CT News Junkie.
Yeah, thanks, Max. I think this was kind of asked, but I don't know if I understood the answer. Is there any different consideration given to someone, whether they be a medical worker or anybody else, who's had the virus before and then recovered from it, as opposed to someone who has never had it before?
I'll take a stab at it, Commissioner. I don't know that we have the right answer to that. As far as I'm concerned, let's otherwise direct it, whether you've had it or not. As long as you meet the criteria, the indications to receive the vaccine, I see no reason why we wouldn't offer it. There's a lot of conversation going on with and without the healthcare space as to whether or not we should or will offer antibody testing to see if they still have antibodies. But the more we learn around the science, or the more that the science answers the questions that we are asking, like the one you just did, I think we'll have a better answer for that in the future.
I agree, Dr. Eady, and I would just add that, we don't know yet for certain how long any natural immunity to this virus lasts. Probably someone who's recently recovered from a COVID-19 infection, we would not immunize immediately. But as Dr. Eady said, as we learn more about the vaccine and the response to it, and we learn more about how the immunity lasts from COVID-19, we'll probably have more guidance around the vaccination for people who've been previously infected.
Gotcha, thank you. Looking at the numbers recently, it seems like cases have sort of been trending younger, people between maybe 10 and 29 years old. Does that change your vaccination strategy? Or are we considering changing it if these are the folks who are being exposed to it more, potentially the folks who are spreading it around more, these younger folks?
No, I don't think it will change the strategy at all. I mean, we have to make sure that we comply with, the guidance that we receive from the manufacturers. And so to the extent if they say, we have not tested or don't recommend, for example, this is just an example, vaccinating pregnant women, then we've got to comply with that until otherwise directed.
Okay. Governor, you touched a little bit about the Republican press conference this morning. In addition to what you already talked about, they also talked about, delaying the payroll deduction that funds the paid family medical leave program. Is that something you might consider doing?
No, I think we have learned during this COVID crisis we need paid medical leave certainly more than ever. In fact, the Trump administration put in place paid medical leave on an emergency basis just so that people would not be reluctant to get tested because they worry about quarantine, they worry about losing pay, not being able to take care of their family. So it reinforced in my mind why paid family and medical leave is so important. So this is the exact wrong time to stop what's going to be a very important change for Connecticut families. Make them safer, make us safer.
How about, they want to use some of the remaining CARES Act fund to maybe replenish the unemployment insurance fund. How about that?
It seems like a pretty dumb idea to me, but it's the first I'm hearing about it. They should give me a call. I mean, right now we get money at virtually zero interest or very low interest from the feds. My hope is we're going to find over time and that we can turn that loan that we get from the feds for the unemployment into a grant, which would make an awful lot of sense. And they should give me some ideas on what they want me to take money away from in terms of our CARES Act fund. Maybe spend a little less on education or a little less on testing. Melissa's got that pretty well allocated. There's not like a lot of money hanging around.
Okay, and one last thing. I called a bunch of state agencies over the past week trying to get a handle on how many businesses maybe have gone out of business this year due to pandemic or otherwise. Is that a number we track as a state, just in general?
A number of businesses go out of business. I got to ask David Lamont that. I know we're tracking it now. I know the numbers we hear from the restaurants, which are under, extreme duress. That's why I'm working hard to keep them open as long as we possibly can and do it safely. I know a lot of other small businesses are hit hard. They've got a lot of fixed costs. I was a small businessman. That's why it's so important that the PPP program get resuscitated now.
Okay, I appreciate it. Thanks, everybody.
The Waterbury Republican American.
I'd like to start off by following up on Kristen Johnson's comments because I don't think she got an answer. Do you or do you not have an estimate on how much vaccine distribution will cost in Connecticut? If you do, what is that estimate? If you don't, why are you unable to estimate that cost?
You want to start with that, Deirdre?
Sure. The vaccine distribution process has lots of different components. As I mentioned, there's a federal component for most of the logistics as well as the cost of the vaccine itself. The vaccine administration will be billed by the vaccinators in many cases to insurance companies. And then the department has some costs that we've already incurred. We've received, I believe it's $2.4 million from CDC for a number of expenses, and we'd be happy to follow up with you and give you the details of how that money was budgeted and allocated. We're anticipating another $1.4 million from CDC by the end of the month. That's been promised to us, and we've submitted a budget for that, which we would be happy, of course, to share with you and follow up. Then the governor enumerated a number of other potential costs that would supplement and support the process that we've been describing this afternoon. And those are costs for outreach, for IT, et cetera, that would assist us, and we are hopeful that our federal partners will allocate, but we are not currently counting on from them because we're still waiting to see whether they will step up and fund those costs.
How long will it take to complete vaccinations of everybody in Connecticut who wants to get vaccinated? The timeline we were provided says folks in, I guess the last group will be started to be vaccinated in June. It's going to take 2 shots each. So how long before everybody who wants to be vaccinated in Connecticut will have the opportunity to get immunized?
Want me to take that, Governor?
On the screen.
So we're, much of that is, as the governor said, is dependent on supply and how many people raise their hand to get vaccinated. We're hopeful that by the early fall, we would be able to have everybody who wants to be vaccinated to have received the vaccine, both doses.
Okay. The allocation subcommittee, I believe, identified 10 hospitals with super freezers capable of holding the vaccination, these vaccines that need to be, I guess, held in deep freeze. Can you give us an update on where things stand with that? What's that sort of capacity?
Yep, we've been working with our hospital partners, and I want to say thank you to them for all of their collaboration and cooperation as we plan for a vaccine rollout. There are a number of hospitals that have the ultra-cold storage, and I'm sorry, I don't remember the number right off the top of my head, but would be happy to follow up with you on which number it is. But we don't anticipate any problems with ultra cold storage capacity in Connecticut, based on what we've learned from our partners.
And when you define healthcare workers, especially in a hospital setting, there are also a lot of folks that don't provide medical care that are intricate to any hospital's operations. What priority will those workers receive? And I'm talking from everybody from changes the beds to cleans the floors and works in the cafeteria, takes your money when you go to park your car.
Yeah.
Yeah, I'll be happy to take a stab at that. That's a great question, and that's a question we're asking ourselves every single day. So, one way to look at it, and again, there's no definitive answer that's been reached yet, but one way to look at it is by department. So, the emergency department is a high risk area, right? Any patient any community member that comes in, we have no idea, and sometimes they don't, what their COVID status is. But to your point, there's a transporter, there's an X-ray technologist, there's a PCA, there's a nurse, there's a physician, and that entire group of healthcare workers are high risk. And so in our minds, at least right now, we're thinking that entire department should be prioritized versus a department that takes care of absolutely no patients. So the finance department that is not patient-facing, for example, we consider that to be a low-risk department, and that would not be higher on the list as related because of the risk stratification as relates to the administration of the vaccine.
And I didn't get a tally. What's the number of towns and cities that are now on the highest COVID alert status? Looks like it's a little redder map today.
You have that, Josh?
We're at 160 towns in the red alert status as of today.
All right, thank you very much.
All right, I'm getting the signal. First of all, Reg, Deirdre, my thanks to you and my thanks to your entire group. You've just reminded me during this press briefing how this is changing even while we're speaking. You've stayed on top of it. You give us a great deal of confidence, and I'm afraid your work is not done yet. And When I'm not dealing with COVID, I'm fighting for the state of Connecticut every day, and that includes getting our shot down in Washington, D.C., and we now have a new supercharged weapon, a supercharged Rosa DeLauro, who's just been made a chairperson of the House Appropriations Committee. And I got to tell you, this is a big deal. You know, we're a state that has been what they call a donor state, sending billions more to Washington, D.C. over the decades than we get back. And Rosa in that position is going to be an incredible asset for Connecticut, Connecticut values, and more broadly, what we want to see done nationwide. And she's part of a supercharged, I got to say, we have a great congressional delegation. You got John Larson, very senior in Ways and Means. Right across the border, Richie Neal is chairman of Ways and Means Committee. Don't forget Joe Courtney, Mr. Submarine. So these are all jobs that used to be for those Southerners, you know, and they'd be old. We got the ever young Rosa and our team, you know, fighting for this part of the country right now and fighting for our values. It's a big plus, and my strong congratulations to Rosa. You earned it. You deserve it. Thank you, everybody.